Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering neuro issues, but to be specific, I'm going to be covering substance abuse and ALS. If you haven't done so already, guys, please don't forget to like and subscribe below. Please don't forget, I'm now on TikTok and I have lots of content there that I don't cover here. So TikTok is just another platform that you can get extra studying time in. Also, I now have a podcast for LPN, RN, and nurse practitioner students. I'm on almost every major platform. I'm on Spotify, Amazon Music, Stitch, like 9 others. So look for Nexus Nursing if you want to get some extra content in. Now on my podcast, for the nurse practitioner students, I actually go over very important content that you need to know to pass your state board exam. Now, for the LPN and RN students on my podcast, I actually answer questions that you may have, and I talk about the nursing program experience from the instructor's point of view. So I think you'll find that interesting. So if you guys have a question, a comment, you can email me at nexusnursingpodcast@gmail.com. Okay, nexusnursingpodcast@gmail.com. All right, guys, without any further ado, let's get started. First question. A friend of an 18-year-old male client brings the client to the ER. The client's unconscious and his breathing is slow and shallow. Which action should the nurse implement first? 1, ask the friend what drugs the client's been taking. 2, initiate IV at keep open rate. 3, call for a ventilator to be brought to the ER. Or 4, apply oxygen at 100% nasal cannula. And guys, the first priority is going to be number 4, giving that patient oxygen at 100%. We want to get that patient perfused as soon as possible. Everything else can come after, but our number 1 priority is getting that oxygen to the patient immediately. All right, guys, second question. The CEO of a large manufacturing plant presents to the occupational health clinic with chronic rhinitis and requesting medication. On inspection, the nurse notices holes in the septum that separates the nasal passages. The nurse also notes dilated pupils and tachycardia. The facility has a no-drug policy. Which intervention should the nurse implement? 1, prepare to complete a drug screen urine test. 2, discuss the client's use of illegal drugs. 3, notify the client's supervisor about the situation. Or 4, give the client an antihistamine and say nothing. And guys, the correct answer is 1. You're going to treat that client, even though they're the CEO, or did it say CFO? Yes. Even though they're the CEO, you're going to treat them like you would any other client. And you're going to do what? Assess. You're going to get that urine test. Why? How are you going to talk to anybody about drugs or anything when you haven't even confirmed that this patient is taking drugs? So that's the first thing you're going to do. You're going to get urine drug screen. The nurse is working with clients in the substance abuse clinic. Client A tells the nurse that another client, Client B, has started using again. Which action should the nurse implement? 1, tell Client A that you cannot discuss Client B with him. B, find out how Client A got this information. 3, inform the healthcare provider that Client B is using again. Or 4, get in touch with Client B and have the client come to the clinic. And guys, the correct answer is A. You make it clear that you cannot discuss another patient with them. HIPAA violation, guys. I know you guys know HIPAA. I'm not going to even dive into that. Next question. A 20-year-old female client who tried LSD as a teen tells the nurse that she has bad dreams that makes her want to kill herself. What is the explanation for this occurrence? 1, the occurrences are referred to as holdover reactions to the drug. 2, these are flashbacks to a time when the client had a bad trip. 3, the drug is still in the client's body and causing these reactions. Or 4, the client is suicidal and should be on one-to-one precautions. And guys, the correct answer is 2. These are flashbacks to a time the patient had a bad trip. And that's exactly what's happening. Now, let's go over the other choices so you can know why they're wrong. Number 1, it says these occurrences are referred to as holdover reactions of the drug. No, they're not. They're referred to as flashbacks because that's exactly what the patient's exhibiting. Choice 3, the drug is still in the client's body and causing these reactions. No, they're not. The drugs are not still in the client's body, but what happens is the effects of the drug is still present. The effects of the drug has altered the patient's brain, and you're seeing that manifestation, but the drug itself is not still in the patient's body. So that's wrong. And then choice 4, the client's suicidal and should be on a 1-to-1 precaution. Well, what makes you think they're suicidal? The client is telling you that she's having bad dreams. The client's reaching out to you about the bad dreams of wanting to kill themselves. So guess what? The fact that they're reaching out to you about the bad dreams of wanting to kill themselves, do they really want to kill themselves? Number 1, if they wanted to kill themselves, they wouldn't call it a bad dream, right? That's number 1. And number 2, they wouldn't be reaching out about it. They're actually seeking help. So they're not suicidal. So the correct answer is number 2. That's actually answering the patient's question. The nurse observes a coworker acting erratically. The clients assigned to this coworker don't seem to get relief when pain medications are administered. What action should the nurse take? 1, try to help the coworker by confronting the coworker with the nurse's suspicions. 2, tell the coworker that the nurse will give all narcotic medications from now on. 3, report the nurse's suspicions to the nurse supervisor or the facility's peer review. Or 4, do nothing until the nurse can prove the coworker has been using drugs. And guys, the correct answer, the only answer here is 3, report the nurse's suspicions to the nurse's supervisor or the facility's peer review. So rule of thumb, whenever you have an issue with a coworker, you always go to the coworker first and you try to resolve the issue before you move up the chain of command. The only exception to this rule is when patient safety is involved. When patient safety is involved, you bypass that nurse and you go to the supervisor. What's happening in this situation? We're suspecting that this patient, the nurse is diverting narcotics and not giving it to the patients, probably taking it himself or herself. So you're not going to confront the nurse about it. You're not going to go directly to the nurse. You're going to go up the chain of command and go to the nurse supervisor or manager. That's why number 3 is the correct answer. Now, very quickly, guys, before I move on to the next question, I want to remind you that my audio lessons are now available on nexusnursinginstitute.com. That's my website. And guys, I created these audio lessons for the students who are struggling with OB, Ped, Psych, fundamentals, whatever. You just need that extra help. I actually go through the content, I break it down, and I point out to you what you're most likely to see on your test so you can focus on it. So guys, if there's anything that you're struggling with or you kind of need help, be sure to check out my audio lessons on nexusnursinginstitute.com. The link is also in my bio. If you don't find the class or course that you need at this time, I'm uploading at an average of about 1 to 2 courses a week. Guys, I'm trying to do the whole nursing program, but it's only me, I'm by myself. So it's gonna take some time. However, I am uploading about 1 to 2 courses every week. So if you don't see what you need now, keep checking and eventually it's gonna show up, okay? So guys, make sure you check out my audio lessons, and don't forget I have podcasts every week, Sunday at 1 p.m. that are available, as well as your as well as your YouTube videos that I also publish Sundays at 1 o'clock as well. All right, guys, let's get to the next question. The client is diagnosed with Wernicke-Korsakoff syndrome as a result of chronic alcoholism. Which symptoms should the nurse assess? 1, insomnia and anxiety. 2, visual or auditory hallucinations. 3, extreme tremors and agitation. Or 4, ataxia and confabulation. And guys, the correct answer is 4, ataxia and confabulation. Why? Well, it says in the question that the patient's got what? Wernicke-Korsakoff. What is most affected? The brain. So we're going to see the patient is going to have ataxia where, their coordination is not up to par, right? They're going to be uncoordinated, and you're going to see confabulation. Confabulation, guys, you learn more about this inside, but that's when patient has gaps in memory, and to make up for those gaps, they lie, they just make it up. They'll have gaps, different time frames that they're just completely missing, and they'll make up a story to try to cover it up. Okay, and that's what we see in the patient with Wernicke-Korsakoff. Now let's look at our other choices. 1, insomnia and anxiety. We see that in patients that are going through alcohol withdrawal. Choice 2, visual or auditory hallucinations, as well as choice 3, extreme tremors and agitation. We see that in patients that are experiencing delirium tremens. Okay, so number 4 is our correct answer for Wernicke-Korsakoff. The client diagnosed with delirium tremens when trying to quit drinking cold turkey is admitted to the med unit. What medications would the nurse anticipate administering? 1, thiamine, vitamin B6, and Librium and benzodiazepine. 2, Dilantin, an anticonvulsant, and Phasol, an iron supplement. 3, methadone, a synthetic narcotic, and Depakote, a mood stabilizer. Or 4, mannitol, an osmotic diuretic, and Ritalin, a stimulant. And guys, the correct answer is 1, thiamine, B6, Librium. So let's talk about this. First of all, any patient that's a chronic alcohol user, we tend to see that they're malnourished and they're missing the very important nutrients and vitamins, okay? So we're expecting to give them the thiamine B6. And the reason we're giving them the thiamine B6, that decreases the rebound effect that patient will experience on the central nervous system. That's why we're giving them the B6. Now, the benzo, and guys, please, if you listen to anything I tell you, this is so important. That benzo, we're giving that patient as a tranquilizer. And we have a patient that's going through alcohol withdrawal. You better give them a benzo. You're going to be in big trouble, okay? So we're giving that benzo to bring them back down. It's going to be used as a tranquilizer. Now let's look at our other choices. 1, Dilantin, an anticonvulsant. Dilantin, this is an anticonvulsant. We use this for patients who have chronic seizures, long-term seizures, not something like an acute seizure as an alcohol withdrawal. That's not necessary. And iron preparation, that's also not necessary. What the patient would have would be a thiamine deficiency, not iron deficiency. So that's wrong. Choice 3, methadone, a synthetic narcotic. Guys, we give that for patients who are going through heroin withdrawal, not alcohol withdrawal. So that's wrong. And then what else? Oh, okay. Depakote, the mood stabilizer. That's not necessary. We don't have to stabilize their mood. Choice 4, mannitol. There's no need to give a patient that's going through alcohol withdrawal a diuretic. And what else? Ritalin, a stimulant. We don't need to give that patient a stimulant. What do we need to give them? Benzos. We're tranquilizing them. We're bringing them down. We're not trying to bring them up. So that's wrong. So the correct answer is number 1. The client's withdrawing from a heroin addiction. Which intervention should the nurse implement? Select all that applies. Now, guys, how do we treat select all that applies? As true or false? So let's get into it. Number 1, initiate seizure precautions. False. Look at what kind of withdrawal the patient's going through. It's heroin, okay? That patient doesn't need to go on seizure precautions. This patient, when they're going through heroin withdrawal, they're going to have chills. They're going to have the goose flesh. By the way, guys, that's where that cold turkey came from. You know how people say, oh, I quit cold turkey. Well, if you ever saw the skin of a cold turkey, how it has all those bumps on them, right? It's called goose flesh. That's what you see in the patient that's going through heroin withdrawal. That's where that term cold turkey came from. So you're going to see goose flesh. You're going to see the patient sweating profusely, right? But seizures is not common in patients that are withdrawing from heroin. Choice 2, check vital signs every 8 hours. Excuse me, you mean to tell me you only going to check that patient once a shift? Absolutely not. You need to be monitoring that patient very, very closely. You're going to be checking them more like every 2 to 4 hours. And guys, I'm stretching it when I say 2. You want to be on the safe side. At least every 2 hours, you're assessing that patient, taking their vitals. Choice 3, place them in a quiet, calm atmosphere. Yes. Absolutely. You don't want any stimulation. You want to decrease their fear and anxiety. They're withdrawing from a very heavy drug, okay? So you don't want to add any increased stress or stimulation to that patient. So you want to put them in a nice, quiet, calming environment. So number 3 is true. 4, have the client have a consent form signed for HIV testing. True. How do patients take heroin? It's injected. And remember, IV drug users, those that inject drugs, they're high risk for HIV. So we definitely want to test that patient for HIV. The nurse is caring for a client who's been abusing amphetamines, writes a problem of cardiovascular compromise. Which nursing intervention should be implemented? 1, monitor the telemetry and vital signs every 4 hours. 2, encourage the client to verbalize the reason for using drugs. 3, provide a quiet, calm atmosphere for the client to rest. Or 4, place the client on bed rest and low sodium diet. And guys, the priority is going to be number 1, watching telemetry and taking vitals every 4 hours. How do we know this? Go back to the question. And what did it say? Cardiovascular compromise. Cardiovascular compromise. And guys, you know what amphetamines do? Increases heart rate to the point that the patient can have a heart attack. Increases blood pressure to the point that the patient can have a stroke. Hence, cardiovascular compromise. So what are we going to be checking? Their heart. We're going to be looking at the telirhythm. Okay, we're going to be taking their vital signs. We're going to be taking their blood pressure. So number 1 is the correct answer. 2, encourage them to verbalize feelings. That's not a priority. Okay, not at this moment. 3, giving them a quiet, calm atmosphere to rest. That's for the insomnia patient, more for insomnia patient. 4, placing the client on bed rest and low sodium diet. That's for a heart failure patient. So the correct answer, guys, is number 1. The client diagnosed with substance abuse is being discharged from a drug and alcohol rehab facility. Guys, excuse me, I'm sorry. Which information should the nurse teach the client? 1, do not go any place where you can be tempted to use again. 2, it's important that you attend a 12-step meeting regularly. 3, now that you're clean, your family will be willing to see you again. Or 4, the client should explain to all the client's coworkers what has happened. I'll give you guys a moment to think of your answer, and I'm going to take a sip of my much-needed coffee. And guys, the correct answer is 2. It's important you attend a 12-step meeting regularly. So guys, addiction is a lifelong struggle, and you're going to teach the patient that they will never be cured. It's always going to be a fight, and they need as much support as possible. And you're going to tell them the importance of regularly attending 12-step meetings, okay? All right, guys, let's get into ALS. Which diagnostic test is used to confirm the diagnosis of ALS? And guys, ALS is Lou Gehrig's disease. It's the same disease, okay? 1, electromyogram. 2, muscle biopsy. 3, serum creatine kinase enzyme. Or 4, pulmonary function test. And guys, the correct answer is 2, muscle biopsy. That is the only 100% way for sure that we can diagnose the patient with ALS, because with that muscle biopsy, we can see that muscle shrinkage and the loss of the muscle fiber, and we know for sure that this patient has ALS and not something else. The client's being evaluated to rule out ALS. Which signs, symptoms would the nurse note to confirm the diagnosis? 1, muscle atrophy and flaccidity. 2, fatigue and malnutrition. 3, slurred speech and dysphagia. Or 4, weakness and paralysis. And guys, the correct answer is weakness and paralysis. So guys, the reason we see this is because remember what's happening in ALS. It's demyelination of those motor neurons. Okay, remember the myelin sheath that actually protects those motor neurons? Well, guess what? They start to eat away, and now those motor neurons are not protected. What's happening in ALS is demyelination of those motor neurons, and that's why you see weakness and paralysis. And that's why these patients with ALS, guys, most often they die from respiratory complication, such as pneumonia or acute respiratory failure, because those muscles just stop working. And so the lungs are supposed to inflate and deflate. They're supposed to expand for the patient to breathe, and they'll get to a point where they just can't do that anymore, and the patient eventually is going to be on a vent, right? So what we're going to see for this type of patient is weakness and paralysis, because we're talking about those muscles. Now, choices 1, 2, and 3, these are all signs and symptoms that you see in ALS, absolutely. But when we're confirming that diagnosis, is number 4, weakness and paralysis. A client with ALS asked the nurse, "I know this disease is going to kill me. What will happen to me in the end?" What statement by the nurse would be most appropriate? 1, you're afraid of how you will die. 2, most people with ALS die of respiratory failure. 3, don't talk like that. You have to stay positive. Or 4, ALS is not a killer. You can have a long life. And guys, the correct answer is 2. Most people with ALS die of respiratory failure. Matter of fact, guys, most people with ALS die of respiratory failure within 5 years of being diagnosed. Okay, so let's look at our wrong answer choices. 1, you're afraid you will die. Even though that is that's therapeutic, because you're creating a dialogue for the patient to, express their feelings. They asked you a direct question, and you need to answer them directly. So even though this, it's a beautiful therapeutic response, it's not a good response for this question. And you guys have to be careful with that, because these test writers will give you a beautiful answer to another question, not your question. This is a perfect example, okay? If the patient's asking a specific question, you need to answer that specific question. So number 1 is wrong. Number 3, don't talk like that. You have to stay positive. Number 1, we don't give advice in nursing. Number 2, you have to create, let's say the question was asking about therapeutic response, it still wouldn't be the answer, because you want to create a dialogue for the patient to express themselves. So number 3 is wrong. And number 4, ALS is not a killer. You can have a long life. No, you can't. Within 5 years of diagnosis, most patients end up dying, okay? So number 2 is the accurate and appropriate response. The client with ALS is admitted to the medical unit with shortness of breath, dyspnea, and respiratory complications. Which intervention should the nurse implement first? 1, elevate the head of the bed 30 degrees. 2, administer oxygen via nasal cannula. 3, assess the lung sounds. Or 4, obtain a pulse ox reading. I love this question, because I'm about to go in on you guys. This is where critical thinking comes in, guys, because I know what some of you guys are thinking. Professor D, you always taught me when the patient can't breathe, always sit them up, because when you sit them up, it helps the lungs expand. It takes the diaphragm keeps the diaphragm from pushing up against the lungs. Patient can breathe better. That's right. But that is when the patient actually has muscles in those lungs to help them expand. With that ALS patient, how much is it really going to help to sit them up? So yeah, you want to sit them up, but if you have to choose between sitting them up first and giving them oxygen first, you better believe it's going to be giving them oxygen first. Where other patients, just sitting them up will increase the oxygenation, then you can give them oxygen, but not for the ALS patient. Because remember, those respiratory muscles are not working, so you sitting them up isn't going to help. So the correct answer is going to be 2. You're going to give them oxygen via nasal cannula, okay? The nurse is caring for the following clients on a medical unit. Which client should the nurse assess first? 1, the client with ALS who's refusing to turn every 2 hours. 2, the client with abdominal pain who's complaining of nausea. 3, the client with pneumonia who has a pulse ox reading of 90. Or 4, the client who's complaining about not receiving any pain medication. And guys, the correct answer is 3, the client with pneumonia. So they already have a respiratory condition, who has a pulse ox reading of 90. 90, guys, this patient's hypoxemic. Remember, We would love the pulse ox to be 98 to 100, but we'll take 95, right? Anything less than 95, that patient's hypoxemic, and that's what's happening. So out of all of these choices that have been given to us, the person that's in a life-threatening situation is number 3. Number 1, 2, and 4 are not in immediate danger like number 3 is. So that's why number 3 is our priority. And I can't believe we are already down to our last question. The client's diagnosed with ALS. As the disease progresses, which intervention should the nurse implement? 1, discuss the need to be placed in a long-term care facility. 2, explain how to care for a sigmoid colostomy. 3, assist the client to prepare for an advanced directive. Or 4, teach a client how to use a motorized wheelchair. And guys, the priority 3, assist the client to prepare an advanced directive. The patient is going to die, and they're going to die sooner than later. So you want to assist the patient to be able to make that choice on how they choose to die. So the correct answer is 3. Guys, I hope you found this video to be helpful. I have so much going on, but guys, I'm doing this all for you. So if you're in the nursing program right now, take advantage, because on YouTube, thank goodness, I have some sponsors, so it's helping out a little bit. But over on TikTok and Instagram and on my podcast, I don't. So I'm just taking that time out for you. So I'm asking you to please help me grow. Maybe I can get some sponsors. Help a sister out, guys. Check me out. I thought I had the list, maybe not. Oh, I do. Let me give you the list of all of the platforms that my podcast is on. Remember, guys, my podcast, I do 2 podcasts every week, one for LPN and RN students, and the second one is for nurse practitioner students. So you can find me, Nexus Nursing, on Spotify, Amazon Music, Stitcher, Podcast Addict, Podchaser, Pocket Cast, Deezer, Listen Notes, Player FM, and Podcast Index. You can find me on all those platforms for my podcast. Of course, audio lessons. If you need help in your class right now, you can check my audio lessons on nexusnursinginstitute.com. If you want some extra studying time just for questions besides YouTube, you can check me out on TikTok and Instagram. My handle is still the same, Nexus Nursing. Guys, thank you so much for spending this time with me, and you'll be seeing me on the next video.